Okay, welcome. Thank you for joining us for this webinar created for child care leadership teams. I'm Justin, Director of the Office of Adult Abuse Prevention and Investigations, otherwise known as OAPI, and I'll be facilitating our webinar today, along with Senate Bill 1515 Project Lead Helen Huang. We will be sharing information about provider reporting requirements and investigations processes in the Department of Human Services, known as DHS. Our hope is that the information shared today will help us all work together efficiently and effectively to keep children safe and well cared for. During the webinar, we'll address topics including reporting requirements for providers, what happens when DHS receives a report of child abuse, the expectations for a child caring agency during an investigation, what happens when a child abuse report is substantiated, and how an investigation or a substantiated report may affect a CCA and its employees. For the rest of the presentation, we will refer to child caring agencies as CCAs. Let's meet the panel now. We'll go around the table and have the panel members introduce themselves. To my left.
I'm Harry Gilmore. I manage the Children's Care Licensing Unit for DHS.
I'm Peter Rosenblatt. I'm the Program Manager for Treatment Services for DHS.
I'm Therese Hutchinson from the Office of Adult Abuse Prevention and Investigations, and I'm the Investigation Section Manager.
I'm Helen Huang, the Senate Bill 1515 Project Lead.
I'm Chris Caro, the Child Welfare Rule Coordinator.
I'm Deb Carnegie with Child Protective Services, Child Welfare.
And I'm Lynn Matthews with the DHS Notifications Desk.
Okay, we have a couple of housekeeping items to take care of before we jump into the presentation segment of our webinar. You should see a small control panel on your screen. In it, you will see a section called Handouts. Click on the plus sign at the left to open the window. There are some documents there that we may refer to, and you can click on them and download them at any time. In your control panel, you'll also see a section called Questions. When we get to the question and answer part of the agenda, we'll be asking you to send us your questions by typing them into the questions window. You also have a chat section in the control panel. If you're having technical difficulties, such as not being able to see our presentation or hear us, you can type a message into the window and send it to us so we can see if there's something we can do on our end to help you. We want you to know that we are recording this webinar and we will post it and make it available to you as soon as possible. Now that you know who's here, let's start with some Senate Bill 1515 highlights. So I'll turn it over to Helen Huang.
Good afternoon. Thank you so much for taking the time to join us today. I hope the information we are going to share in the next hour is informational and helpful in your day-to-day work. As many of you know, Senate Bill 1515 passed last spring and was put into effect July 1, 2016. Senate Bill 1515 increases the Department of Human Services oversight of CCAs. The goal is to keep children safe and well cared for. The areas of SB 1515 that we are focusing on today are changes that affect how we work with you, our providers, including the expansion of definitions, reporting requirements, notifications, and what to expect. First, before we get into the details of SB 1515, we want to clarify for you who DHS is and the different programs that impact CCA reporting. While we understand our roles and responsibilities when a report is received, it is not always clear for you, our providers. Don't worry, this information is in your handout for your reference. At any time, there may be one or more parts of DHS working with you or your staff. We have at least one person here from each of these offices. They will now take turns to give you a quick description of their roles. First up is Therese Hutchins from the Office of Adult Abuse Prevention and Investigations.
Good afternoon. What is OAPI? OAPI, which is under DHS, is responsible for investigating child abuse involving most CCAs and a child receiving services. OAPI has the authority to determine who is responsible for child abuse. Next up, Deb Carnegie with Child Protective Services, or CPS.
Thank you, Therese. What is CPS? CPS, which is under DHS Child Welfare's Child Safety Program, is responsible for investigating child abuse involving a Proctor foster parent's own child, child-on-child sexual abuse, and all child abuse involving homeless and runaway transitional living shelters, adoption agencies, and academic boarding schools. CPS has the authority to determine who is responsible for child abuse and to take children into protective custody. Next, Harry will give you a quick description of the Children's Care Licensing Unit.
Thanks, Deb. What is the Children's Care Licensing Unit? The CCLU, which is under the DHS Office of Licensing and Regulatory Oversight, is responsible for issuing and overseeing child caring agency licenses. This includes ensuring compliance with Oregon Administrative Rule licensing requirements. The licensing unit has the authority to suspend and revoke a license, as well as to impose fines and require actions. Next, Peter is here to talk about the Child Welfare Wellbeing Program.
Thank you, Harry. What is the Wellbeing Program? The Wellbeing Program is under DHS Child Welfare and is responsible for monitoring compliance with Oregon administrative rules, BRS requirements, and contracts. The Wellbeing Program has the authority to require a CCA to make changes to ensure contract compliance and to recommend best practice changes for children's care and treatment.
Thank you, Peter. Now let us move on and give you some information on reporting requirements. Here's Deb.
CCAs have an important role in protecting the safety of a child and an additional role in protecting the well-being of a child in care. As an employee of a CCA, the law requires you to make a report when you suspect child abuse. Licensing rules require you to report critical events, and behavior rehabilitation services rules and contracts require you to report incidents. The goal of all these reports is to ensure high-quality care for children. First, let's talk about mandatory reporting of child abuse. The definition of child and the definition of abuse were both expanded with the passage of Senate Bill 1515. It is important to understand the impact these changes have on mandatory reporting of child abuse. The definition of child. A child meant and still means a person under the age of 18. Now, however, a child also means a person 18, 19, or 20 years old living in or receiving services from a CCA or Proctor foster home. That's right, the definition now includes a person 18, 19, or 20 years old, but not any 18, 19, or 20-year-old, just those living in or receiving services from a CCA or Proctor foster home. A Proctor foster home is a foster home certified by a CCA. Prior to Senate Bill 1515, Proctor foster homes were commonly referred to as therapeutic foster care. As for a CCA, while you are familiar with the CCA you work at, remember that a CCA refers to a private agency or private organization licensed by DHS and includes psychiatric day treatment for children, adoption placement services, residential care, including Proctor foster care or residential treatment, boarding schools, outdoor youth programs, or other similar care or services for children. A CCA does not include daycare or child care, whether operated out of a home or center. The other definition change impacting mandatory reporting specific to CCAs is the definition of abuse. Child abuse continues to include physical abuse, neglect, sexual abuse, mental injury, threat of harm, buying or selling a person, permitting a person under the age of 18 to enter or remain where methamphetamines are manufactured, and unlawful exposure to a controlled substance. Now, when talking about abuse of a child living in or receiving services from a CCA, abuse also includes verbal abuse, involuntary seclusion, wrongful use of physical or chemical restraint, financial exploitation, and abandonment. There is a handout available to you in the control panel that provides more detail about the types of abuse. Despite the expanding definitions of child and abuse, your mandatory reporting obligation continues to be that when you suspect a child you come in contact with has been abused, or a person you have come in contact with has abused a child, you must report immediately to DHS or local law enforcement. You can report to DHS by calling 1-855-503-SAFE or by calling your local DHS office directly. You are a mandatory reporter 24 hours a day, 7 days a week, even when you are at home and not at work. It is important to remember you don't have to know abuse occurs, and when in doubt, err on the side of child safety and call to talk to a screener. When someone does call and report child abuse, a screener will gather information, not only the information provided by the caller, but from other sources as well. The screener then must review the information to determine if the report meets the criteria to be assigned for investigation. Harry Gilmore will now talk about what reports are required.
Thanks, Deb. Again, this is Harry Gilmore from Children's Care Licensing. As Deb mentioned, I will now talk about what reports are required but are not part of your mandatory reporting obligation. While critical event reporting and incident reporting are different from mandatory abuse reporting, there are times that more than one type of report is required for the same event. A critical event is a significant event considered likely to cause complaints, generate concerns, or come to the attention of media, law enforcement agencies, first responders, child protective services, or other regulatory agencies. A critical event must be reported within 1 business day from the time the event occurred and is reported to the assigned licensing coordinator by emailing childrenscare.licenses@state.or.us. Again, that email address is on your screen. Peter Rosenblatt will now cover incidents. Peter.
Thank you, Harry. In regards to incidents, please keep in mind that this section only applies to Behavioral Rehabilitative Services, or BRS. Remember, there may be additional reporting requirements from the Oregon Health Authority, also known as OHA, or another entity that will not be addressed in this presentation, as today we are only talking about DHS reporting. So, as it relates to incidents and BRS, an incident includes all incidents and crisis interventions, including but not limited to use of seclusion and physical restraint, a risk to the status or custody of the BRS client, or other incidents likely to cause complaints, generate safety, programmatic, or other serious concerns, or come to the attention of the media or law enforcement. There are 3 timelines for reporting incidents. Serious incidents require immediate verbal notification, followed by a written report within 1 business day from the time the incident occurred. When the incident is the use of a seclusion or physical restraint, a written report is required within 5 business days from the time the incident occurred. Both serious incidents and incidents related to seclusion and restraint are reported to the DHS caseworker and to the assigned child welfare compliance specialist. Finally, all other incidents are reported at the end of the month to your child welfare compliance specialist. Please utilize the attachment that outlines reporting requirements, as we know that this is a lot of information to remember. Here again is Deb, as she will now go over some scenarios with us.
Thanks, Peter. Now that we have talked a bit about mandatory reporting of child abuse, critical events, and incident reporting, let's talk through a few common scenarios and what type of report would be required, if any. An example may be an employee walks in a room and a child is dressed in a manner that their breast or bottom is seen by the employee. The employee immediately turns around and the child covers themselves. This is an example of an incident and the type of incident that would be reported at the end of each month. Where this would become a report of child abuse, a critical event, and an incident that requires immediate reporting is if a child starts disclosing that the employee keeps walking in on them while they are partially robed, or the child reports that they catch an employee looking at them through the window of their room, and it always seems to be when they are getting changed. Children fighting is another topic that often comes up. So let's say children are physically fighting one another. An employee did not incite the fighting and took all appropriate actions to intervene and maintain child safety, including contacting police. This is an example of a critical event and the type of incident that requires an immediate report. A similar circumstance with two children fighting, but in this example, an employee told children who were arguing to resolve the dispute with a physical fight. This is an example of a report of child abuse, a critical event, and an incident that requires an immediate report. Let's talk through a few examples related to child injuries. A child falls and scrapes their knee or sustains a different minor injury while playing. The employee did not push the child and made sure the child received timely and adequate attention to the injury. This is an example of an incident that requires a report at the end of the month. Another child falls off play equipment and breaks an arm. There are no concerns about supervision. This child is immediately taken to the emergency room. This is an example of a critical event and the type of incident that requires an immediate report. In the same example, if you change one detail and the child is not taken to the emergency room despite a clear indication of a break or the child complaining of mobility restrictions, then there is also a report of child abuse. Next, let's talk about restraints. Before diving into a few examples involving a child being restrained, I want to be clear that we are talking about restraints as defined in an administrative rule and not referring to every time an employee lays hands on a child. The first example, the circumstance is that a child was restrained. There are no concerns whatsoever. This is an example of an incident that requires a report in 5 days. While restraints are reported in 5 days when there are no concerns, like in the example just provided, if there is a concern, while restraints are reported in 5 days when there are no concerns, like in the example just provided, if there is a concern, such as an improper restraint or a restraint in a hands-off CCA, then the report must be made immediately. Another example may be a child is properly restrained and says, "ow," or reports being in pain at the time of the restraint. After the restraint, no injury is observed and the child states they are not in any pain. This is another example of an incident involving a restraint that requires a report in 5 days. A final example involving a restraint, a child is properly or improperly restrained and sustains an injury, or is expressing later that day that they are in pain. This is an example of a report of child abuse, a critical event, and an incident that requires an immediate report. It only takes one detail to change whether a report is needed, and if so, what type of report. With that said, these examples are intended to provide guidance on the principles of reporting. If you suspect a child has been abused, make a report of child abuse to a DHS screener or law enforcement. A report of child abuse will always fit the definition of a critical event or incident, even though not all critical events or incidents are abuse reports. If you aren't worried about abuse, but are unsure if the circumstance is a critical event, contact your licensing coordinator. Or, if unsure if a circumstance is an incident, contact your compliance specialist. Harry will now cover what to expect when a concern is reported.
Thank you, Deb. As a group, DHS created a document that outlines all of this information. This document is included in this webinar. We hope it is helpful. The purpose of this section is to inform our CCAs on what to expect when DHS follows up on a report of a concern involving a CCA. First, please know that if you are licensed or have contracts with agencies in addition to DHS, those entities have their own processes to follow up on concerns. Therese from Milwaukee will now give you some detail on what a concern is. Therese.
Thank you, Harry. A concern may include a report of child abuse, a report of a licensing violation, or a report of a BRS rule or contract violation. Depending on the type of concern, an WAPI investigator, CPS worker, licensing coordinator, well-being compliance specialist, or the assigned caseworker will follow up. It is important to understand that while each of these programs or roles are under DHS, each has unique responsibilities, and as such, a singular event may necessitate multiple programs following up in different ways and each with their own separate outcome. You should expect that the executive director and/or agency employees may need to talk to multiple people from DHS to adequately address child safety, licensing, and well-being needs. While communication between OWAPI, CPS, licensing, and well-being is required, and efforts have been made to reduce redundancy, because the roles are very different, it should be expected that there will be some overlap in efforts. Before we talk more about the follow-up, we want to make sure to share with you who is notified when a concern is reported. Lynn Matthews now joins us to explain notifications.
Thank you, Therese. DHS is required to make notifications when a concern is reported involving a CCA. Keep in mind, when it is determined that the information reported is not a concern, no notifications will be made. Okay, as I describe who receives notifications and how those notifications are made, remember, this is the process as it exists today. Those that are being notified include state agencies that contract with the CCA or have regulatory oversight. Typically, include licensing, well-being, Oregon Health Authority, Oregon Youth Authority, and the assigned DHS caseworker and their supervisor. Also notified is the CCA Executive Director. The information shared with the Executive Director may vary depending on whether the concern is a report of child abuse or not, and may include a brief description of the concern. Who else was notified of the concern, whether additional follow-up by DHS will occur, and if so, who is assigned to follow up. When it is determined that an investigation of child abuse will be assigned to a WAPI or CPS, the child's parent or guardian, the court-appointed special advocate, also known as CASA, the child's attorney, and the attorneys for the parents are notified. All of these notifications are typically sent by email. Finally, law enforcement is notified if it is a report of child abuse, and this occurs whether the report is closed at screening or assigned. I'm tossing it over to Harry now to describe what to expect when licensing is notified of a concern. Harry?
Thanks, Lynn. Okay, when licensing is notified of a concern, you as a provider can expect to be contacted by a licensing coordinator if the notification received indicates follow-up by licensing will occur. The response may range from a phone call or email to a site visit, interviews, or a document request. Any outcome resulting from follow-up on a reported licensing violation will be communicated to the CCA by the assigned licensing coordinator. Peter, what happens when well-being is notified of a concern?
When well-being was notified of a concern, the CCA can expect to be contacted by their compliance specialist. The response may range from a phone call to a site visit, to some emails, interviews, or even document requests. Any outcome resulting from follow-up on a reported VRS contract violation will be communicated to the CCA by the assigned compliance specialist. Therese now joins us to cover what to expect during a child abuse investigation.
Thank you, Peter. Unlike licensing and well-being, OWAPI and CPS have the role of determining whether abuse occurs. As Peter mentioned, we want to make sure you have a general idea of what to expect during a child abuse investigation. When a report of child abuse is assigned for investigation, whether it is a WAPI or CPS investigating depends on the type of CCA, who the alleged perpetrator is, and who the alleged victim is. Sometimes both a WAPI and child welfare have a role in the investigation. When this happens, efforts will be made to coordinate interviews and collaborate the response where possible. Regardless of who responds, the assigned investigator or the CPS worker will gather information by observing the environment, requesting relevant documents, and conducting interviews with the accused alleged perpetrator, the alleged victim, and other individuals who may have information relevant to the report. In some cases, a medical assessment of the child may be needed. In all cases, the parent or guardian of any child interviewed will be contacted. The owner, manager, operator, or appropriate authority responsible for the CCA will be contacted at the beginning of the investigation to arrange for access to the facility, plan interviews that will take place at the facility, and gain access to the names of children, employees, or others who may have information relevant to the report. After information is gathered, the investigator and the CPS worker must determine if there is reasonable cause to believe child abuse or neglect occurred. Both AWAPI and CPS have timelines for completing this process. AWAPI has 30 business days to complete the investigation, and CPS has 30 calendar days, or in counties where differential response is implemented, CPS has 45 days. Both AWAPI and CPS are permitted extensions when critical information is outstanding. Once the child abuse investigation is completed, there are 3 possible outcomes for each allegation of child abuse investigated. They are as follows. Substantiated, which means there is reasonable cause to believe that abuse of a child in care occurred. Inconclusive, which means there is some indication that the abuse of a child in care occurred, but there is insufficient evidence to conclude that there is reasonable cause to believe that the abuse occurred. And unsubstantiated, which means there is no evidence that abuse of a child in care occurred. AWAPI and CPS will only determine if there is reasonable cause to believe child abuse occurred. It is not their job to determine if rules or contracts were violated. Monitoring compliance with licensing rules is the role of the assigned licensing coordinator, and monitoring compliance with contracts is the role of the well-being compliance specialist. It is because each program has a unique role that there is more than one kind of report. In regards to outcomes, it is important to understand that different programs may reach different conclusions as a result of following up on a concern. For example, there may be an unsubstantiated determination from AWAPI in a situation of alleged neglect against the CCA, but the same information results in a substantiation from the CPS for a child sexually abusing another child. Likewise, information that resulted in an unsubstantiated determination from AWAPI may still result in a licensing or program action. While we have talked about different DHS-determined outcomes, remember not every report requires a response from each program, and there may be a response from government entities other than DHS, such as Oregon Youth Authority or Oregon Health Authority. As for notifications at the conclusion of a child abuse investigation, regardless of the outcome, unsubstantiated, inconclusive, or substantiated, DHS now notifies all individuals and entities that were notified of the initial child abuse report. Also, when any allegation is substantiated on the CCA or the Proctor foster home, the following additional notifications occur. Any government agency or unit that has a contract with the CCA to provide care or services, the parent of a child not in the custody of the state who resides in or receives services from the CCA at the time of the substantiation, the assigned caseworker for each child in the CCA, the DHS director, and the DHS child welfare director. Next, Harry will address what besides notifications to expect when a child abuse report is substantiated.
Thank you, Drew. After the investigation is complete, a licensing coordinator will contact the CCA and discuss next steps. There are many possible next steps depending on what information was gathered during the investigation. Those steps range from no further action to additional training requirements, a plan to achieve full compliance, or a change in the status of the license. Separate from DHS actions, the CCA is responsible for taking actions necessary to ensure the safety and well-being of the children residing in or receiving services from the CCA. Such action may include personnel decisions, and at a minimum must include initiating a new background check and fitness determination for any identified perpetrator who remains employed by the CCA at the time of a substantiation. Anyone identified as a perpetrator, that is, anyone who receives a finding of substantiated, will be sent a notice of the outcome, which includes information on how to request a review of the finding. Now I'll hand it over to Justin to begin our question and answer portion of the webinar.
Thanks, Harry. I just want to remind everybody that in your control panel you'll see a section called Questions. Please, if you have questions, feel free to type them in that window and we will answer your questions. We're actually going to give everybody about 5 minutes to enter questions. We're going to put you on mute in the meantime and we'll get back to you in about 5 minutes. Okay, everybody, we're back. Thanks for submitting your questions. We want to let folks know that if your question is not answered during the webinar, DHS will respond to you directly. Each scenario is so unique, and our panel is going to need to get more information about your questions in order to give you an informed and accurate response. So just because we're not answering it today does not mean you will not get a response or someone else won't get in touch with you about it. So stay tuned. As for some of the questions that came in, one question that comes up regularly is, can DHS place a CCA employee on leave or terminate their employment? Harry, could you take that one?
Sure. The answer is no. Only a CCA can place an employee on leave or terminate their employment. However, depending on the circumstances, a safety plan may be developed and may include a CCA employee not having contact with a specific child or all the children being served by the CCA. It may also include a limitation being placed on specific duties an employee can perform. If the CCA is not willing to take the steps necessary to ensure the safety of a child or children, including restricting contact with an employee when necessary, DHS can take steps to remove the child or children from the CCA.
Okay, thanks, Harry. Another question that's come in, what's happening with Senate Bill 1515 in the upcoming legislative session? Chris, could you take that one?
Yeah, DHS does not have its own bills related to Senate Bill 1515. However, DHS leadership worked closely with Senator Gelser prior to the legislative session regarding possible changes to the law. Senator Gelser has introduced several separate legislative concepts. One reduces some of the external notifications the department is required to make when reports are received, such as to federal and out-of-state government entities who contract with a child caring agency. Another bill provides an off-ramp for mandatory revocations if the director of the department and the Department of Justice agree that child safety concerns have been addressed. A couple additional concepts make technical fixes to definitions. Another bill will not impact child caring agencies, but it does expand the definition of abuse that applies to child caring agencies to other substitute care settings, including DHS foster homes and DD facilities. Also, although not directly related to Senate Bill 1515, but probably of great interest to some of you, the governor's recommended budget includes a BRS rate increase. It's important to remember that these bills may or may not pass, or they may pass with significant amendment. Additionally, other legislators or advocacy groups may have legislation related to child caring agencies that the department is not yet aware of. Janet Ahrens and Doug Riggs will likely be communicating with providers about that through the Alliance, but you can also contact me, Chris Scaro, if you want information about how to track the legislative process.
Okay, thanks, Chris. So we had a question about well-being compliance specialists and how do providers know who their well-being compliance specialist is? Peter, can you take that one?
Sure. If you are a CCA that is contracted with the well-being program, which again is part of DHS's child welfare, then you do have a contract and compliance specialist. If you are not sure who that person is, feel free to contact me, Peter Rosenblatt, and I will be more than happy to connect you with your contract specialist.
And sort of piggybacking on that, Peter, how will providers be informed about the results from the well-being unit about the resolution of any issues?
Sure. The compliance, the contract and compliance specialist will loop back with the CCA at the end of the process.
Okay. Thank you. And again, if we did not get back to you on your question, you will be hearing from somebody from DHS to get more information about the specifics of your question so we can give you an accurate answer. So lastly, the providers are also asking for additional training. As a supplement to this webinar and the materials provided, we are providing face-to-face presentations for our providers. If you need additional training, please contact Helen Huang. Her information is provided on the screen. She can help coordinate a date and time most convenient for you. Now here's Helen to tell you more about some additional tools and training that you can access.
Thanks, Justin. Today's presentation is one of several efforts underway to provide support and tools to our CCAs. As Justin mentioned, we can come out and offer face-to-face training. We will also continue to produce information sheets and quick reference guides like those in today's presentation. Coming available very soon, we have a computer-based training and development for all CCA employees. Stay tuned for a release date and how you can participate. In addition, don't forget to visit the Senate Bill 1515 page on the DHS website, or you can Google Oregon Senate Bill 1515. We're also looking forward to the results of the work groups for the House Bill 2856. You remember that the bill aims to reduce administrative burdens on providers, and this year is focusing on BRS providers. 3 work groups are underway focusing on uniform auditing processes, uniform reporting forms, and shared information procedures, so expect to hear more about this as we go. Thank you so much for your patience. We're almost done. But first, a few words from Justin to close out this webinar.
Thanks, Helen. So we're ready to wrap up the webinar. We hope this presentation was helpful to you and hope that you will take the time to complete a follow-up survey that you'll be receiving. I also want to remind you that the webinar is being recorded, and we'll get the link to you if you'd like to revisit the content later or share with your teams. So again, thank you for participating today. It takes all of us working together to keep children safe and help them thrive, and we certainly appreciate all that you do and look forward to strengthening our partnerships. Thank you.